A sobering statistic, 2020 will go down as the deadliest year in U.S. history. Deaths have topped 3 million for the first time ever. The coronavirus is mostly to blame for that, with more than 300,000 lives lost so far. The increase in deaths would be up about 15% from 2019, making it the largest single-year jump since 1918. As coronavirus cases continue to rise, hospitals across the country and here locally will have to make some difficult decisions. Health editor Dr. Maria Simbra reports on the rationing plans in the works.
As COVID-19 infections surge and intensive care units fill, states and hospitals may have to make difficult decisions.
It was foreseeable. It was one of the most important things that we were trying to avoid.
States must figure out how to distribute patients among hospitals, and hospitals need to determine how to stretch their supplies and personnel.
You can ask manufacturers to manufacture more ventilators. You can stop elective procedures and try to create more hospital beds that you can fill with COVID patients. It's very difficult to train new personnel.
Earlier in the pandemic, staff from less hard-hit areas could travel to hotspots, but now it's different.
Lots of places are dealing with high levels of demand, and so we're reaching a point where there's a concern about how much flexibility we have in moving providers around the country.
Organizations such as the American Medical Association, the National Academy of Medicine, and the American Nurses Association warn critical decisions will have to be made about how to use limited resources to do the most good for the most people.
When you get into that situation, you want to have prepared. You want healthcare providers to be making those decisions not off the cuff on the basis of their own values. You want them to be making difficult decisions that are implementing a policy that you've prepared in advance.
For instance, decisions might be based on an individual's likelihood of dying, but not on blanket criteria such as age or disability, or even simple metrics such as saving the greatest number of people when certain people play a role in helping others through the pandemic.
They have to be simple enough that you can implement them in real time. They also have to be something that you can justify to the public. There's a real challenge to show deep respect for every individual life, where every individual is irreplaceable, but you're in a situation in which you simply can't save everyone.
Difficult trade-offs reflecting important values. I'm Dr. Maria Simbra, KDKA News.